Basically, the only way to remove a cataract is to remove it whole, because once you open the colored shell of M&M, or the capsule, which of course in the human eye is translucent, otherwise you won't be able to see through it. So we make a round window in the front part of that capsule, and then we use fluid waves and complex techniques to shell it out, so to speak. Then we break it up into small pieces and remove it. And once we open that capsule, those proteins that are inside the cataract are actually exposed to the rest of the eye where they shouldn't be. So we've got to remove it all in one piece. Every little last bit of it's got to come out for you to have a very good result. Otherwise, those proteins that aren't typically exposed to the eye cause inflammation. So we make that round window in the capsule. We use a fluid wave to shell out the whole cataract, and then we break it up using a little ultrasound probe, which is very, very complex. But to make it a little bit easier to understand, it basically uses fault lines through the cataract to tear it apart, and also to crush each piece and vacuum it out of the eye. So it's all done in one probe, which is very intelligent, and it has power sensors, flow sensors, all sorts of things in that process. So it's actually quite sophisticated. And that's what's called phacoemulsification. Emulsification because it breaks the cataract down into smaller pieces like an emulsion, fluid-like emulsion, and the phaco part refers to the cataract. But yeah, modern surgery uses ultrasound technology to do that. So after that is removed, we place some gels to expand the lens and put in an artificial lens implant inside the eye. Then we wash everything out, a bit of antibiotic, and away you go.
Okay, so we'll talk a little bit about the lens implants in a second, but before we do that, there's a couple of other techniques I've heard about. One is called FLACS, or femtosecond laser assisted cataract surgery, and YAG laser procedures, and I'm not even going to try and explain what YAG stands for.
Okay, so the first one is femtosecond laser assisted cataract surgery. So there was a trend almost about a decade ago where we started utilizing the lasers that we use for laser eye surgery vision correction to make the microscopic cuts that we make in cataract surgery, including the wound, which by the way is approximately a 2.4 millimeter wound, so less than 2.5 millimeters, a small wound, which is 1 millimeter, like a side wound, and then the opening of that capsule, and to also break up the cataract into pieces. The studies that did that, and we're talking high volume studies that came out of the United States and even some out of Tasmania, didn't really prove that there was necessarily a outcome-based benefit for the patient of doing that when the surgeon is very experienced. So the laser obviously made nice cuts and things like that, but the other problem with the laser is sometimes the cuts weren't complete because it's a bit more like a perforation, whereas the cuts we make are complete and very precise. So there were some problems while people were getting used to it at the beginning. The procedure takes longer because the patient has to be wheeled into the laser suite, which has a very controlled temperature and humidity environment, and they get the laser parts of the surgery done. Then they have to be wheeled out and wheeled into the theater suite. The laser wounds are then opened up with instruments, and then the cataract is removed by phacoemulsification in the fashion that we talked about. So really, it's only doing the most simplistic parts of the procedure, which are the wounds and that little round rhexis, which a skilled surgeon is very good at doing. So in summary, it takes a bit longer. There's no advantage. And in the centers where I've watched them do that overseas, where I've been to visit other clinics, there is a lot of anxiety that the patient has between moving one room to another, because they've just had part of the procedure and they're like, oh, what's going to happen next? Whereas the whole surgery really takes 12 to 13 minutes in one sitting in the operating theater. So why put the patient through that and, give them more anxiety, make the experience less favorable for them for no real visual benefit in the end.
Okay, got it. And what about YAG or YAG laser procedures? What's that all about?
So basically, YAG stands for the elements that are used to produce the laser. So I won't go into their names, but basically a YAG laser is used after cataract surgery. So 1 in 10 patients develop a little bit of an opacified layer along that natural capsule. Remember, we talked about that capsule. It's a natural structure. It's usually translucent, and it's like that colored shell of the M&M, and the lens goes into that little pocket. In 1 in 10 patients over time, you get a little membrane because that capsule, it's lined by cells because it's a natural structure. And over time, for whatever reason, those cells can replicate. And so then they grow across the capsule using it as a scaffold and cause a bit of an opacity. And this could happen as early as 3 months after the operation, or as late as 10 years plus after the operation. That is a super simple fix, because by then the lens is well adhered into position with the edges of that rexus closely adherent to the edges of the lens implant. And we use a laser to just make a few perforated openings like a window in the back of that capsule. That falls to the back of the eye and the body breaks it down because it's a natural structure, and the vision's clear again. And you only need to do it once, it doesn't grow back. And so I've had patients where we've done capsulotomy, and then they've come back and said to me, "Doctor, as soon as I walked out into the car park, the vision was already better." So it's really quite a quick, easy, painless, and extremely low risk fix for that problem.
Okay. Is it true that the YAG laser is also used for treating floaters in the vitreous? Is that something that
Yeah,
your
absolutely.
colleagues might use?
It can be, yes. I've
Yeah,
done this procedure myself. The
yeah,
difficulty is it's only suitable for certain types of floaters.
yeah.
So it will need an examination by a doctor, a good dilated examination, and the floater has to be close to the front of the eye
Right.
rather than close to the retina, and it has to be non-central. So it has to be just off the center for us to be able to use the laser pulse to disperse the floater, so to speak, effectively and safely.